How to naturally treat ADHD. Attention Deficit Hyperactivity Disorder, ADHD, is a brain disorder that impacts a person's ability to focus and concentrate. Some individuals suffer from hyperactivity and other symptoms. Once you receive a diagnosis, you may seek medical treatment. However, you may be able to reduce your symptoms with natural remedies. Determine if you have inattentive symptoms of ADHD. In order to qualify for a diagnosis, you must exhibit at least 5 symptoms, for an adult, or 6 symptoms, for a child 16 and under, in more than one setting, for at least 6 months. Symptoms must be inappropriate for the person's developmental level and be seen as interrupting normal functioning on the job or in social or school settings. Symptoms for ADHD, inattentive presentation, include: makes careless mistakes, is inattentive to detail, has trouble paying attention, tasks, playing, doesn't seem to be paying attention when someone is talking to him, doesn't follow through, homework, chores, jobs, easily sidetracked, is organizationally challenged, avoids tasks requiring sustained focus, like schoolwork, can't keep track of or often loses keys, glasses, papers, tools, etc. Is easily distracted. Is forgetful. Determine if you have hyperactivity, impulsivity symptoms of ADHD. Some symptoms must be at the level of disruptive for them to count in a diagnosis. Track if you have at least 5 symptoms, for an adult, or 6 symptoms, for a child 16 and under, in more than one setting, for at least 6 months. Fidgety, squirmy, taps hands or feet. Feels restless. Struggles to play quietly, do quiet activities. On the go as if driven by a motor. Excessive talking. Blurts out even before questions are asked. Struggles to wait for his turn. Interrupts others, inserts self into others' discussions, games. Assess if you have combined ADHD. Some people with ADHD present symptoms from both inattentive and hyperactive, impulsive criteria. If you have 5 symptoms, for adults, or 6 symptoms, for children 16 and under, from either category, you may have combined presentation of ADHD. Get diagnosed by a mental health professional. As you determine your level of ADHD, seek the guidance of a mental health professional to make an official diagnosis. This person will also be able to determine whether your symptoms can be better explained by or attributable to another psychiatric disorder. Ask your mental health professional about other disorders. As if having an ADHD diagnosis isn't challenging enough, 1 out of every 5 with ADHD is diagnosed with another serious disorder. Depression and bipolar disorder are common partners. 1/3 of children with ADHD also have a behavioral disorder, conduct disorder, oppositional defiance disorder. ADHD tends to pair up with learning disabilities and anxiety, too. Getting organized. Use a daily planner. Organization and consistent routines will help you stay on top of your daily activities and projects. Buy a planner that has plenty of space to write daily notes. Before you go to bed, look at your calendar for the next day. Then you will know what to anticipate and what you need to get done. Break up large projects into smaller ones. Thinking about the overall picture can be overwhelming. Break down a large project into small manageable pieces that can be accomplished readily. Make a to-do list for each project. Then write down the steps that will accomplish the full project. Cross them off as you finish each one. Get rid of clutter. Clutter can contribute to feeling overwhelmed and distracted. Reduce the amount of material sitting around on counters and shelves. Throw out junk mail right away, and get yourself removed from mailing lists for catalogs and credit card offers. Get online bank statements instead of paper copies. Have designated places for important items. You may find yourself getting overwhelmed if you constantly have to look for your keys and wallet. Choose a spot where you will always put your keys, such as on a key hook by the door. Making dietary changes. Eat complex carbohydrates to boost serotonin levels. Persons with ADHD tend to have lower serotonin and dopamine levels. Many people experiment with changes in their diet in order to counter-effect these deficiencies to some extent. Experts recommend a complex carb diet to boost serotonin for improved mood, sleep, and appetite. Skip simple carbs, sugars, honey, jelly, candy, soda, etc., that cause a temporary serotonin spike. Instead, choose complex carbohydrates such as whole grains, green vegetables, starchy vegetables, and beans. These all act as an energy time release. Improve your focus by eating more protein. Eat a protein-rich diet that includes several proteins over the course of the day to keep dopamine levels high. This will help you improve your focus. Proteins include meat, fish, and nuts, as well as several foods that double as complex carbs, legumes and beans. Choose omega-3 fats. ADHD experts recommend avoiding bad fats such as those found in trans fats and fried foods, burgers and pizzas. Instead, choose omega-3 fats from salmon, walnuts, avocados and more. These help promote a healthy brain, and some studies suggest that they may be helpful in reducing negative symptoms of ADHD. These foods may help lower hyperactivity while improving organizational skills. Experiment with eliminating certain foods. Some studies have suggested that eliminating wheat and dairy, as well as processed foods, sugars, additives and dyes, especially red food coloring, can have a positive impact on behavior in children with ADHD. While not everyone will be willing or able to go to that length, some experimentation may produce improvements that make a difference. Although it is a common belief that sugar and food dyes are linked to negative effects in people with ADHD, numerous rigorous studies have not demonstrated a link between these substances and problems with ADHD. However, sugar is a source of empty calories and food dyes are often present in heavily processed foods, so reducing or eliminating these substances will likely improve your overall health. Talk to your doctor about dietary changes. Be certain to run any major changes in diet by your doctor. This includes changes related to vitamins and supplements. Ask your doctor about any conflicts that could negatively impact your ADHD medication. Your doctor can also suggest recommended dosages of various supplements and warn of possible side effects. For instance, melatonin may improve sleep in persons with ADHD, but it might also induce vivid dreaming, which may be unpleasant. Finding support. See a mental health therapist. Adults with ADHD generally benefit from psychotherapy. This treatment helps individuals accept who they are, while at the same time helps them seek improvements to their situation. Cognitive behavioral therapy directly geared toward treating ADHD has been useful for many patients. This type of therapy addresses some of the core problems caused by ADHD, such as time management and organizational issues. You may also suggest to family members to visit a therapist. Therapy can also provide a safe place for family members to vent their frustrations in a healthy way and work out issues with professional guidance. Join a support group. Numerous organizations provide individual support as well as networking amongst members who can get together online or in person to share problems and solutions. Search online for a support group in your area. Find online resources. Assemble a support network. Persons with ADHD need to understand how to recognize and reduce stress and frustration before they get out of control and lead to anxiety, depression, or even substance abuse. Making lifestyle changes. Spend more time in nature. Get plenty of sleep. Poor sleep habits can heighten ADHD symptoms, whereas a good night's sleep has the potential to do the opposite. Make an effort to have a regular sleep pattern. Go to bed at the same time every night and wake up at the same time in the morning. Aim to get 7 to 8 hours of sleep for adults or 10 to 11 hours of sleep for children every night. Limit your screen time to 1 hour per day, which includes television, video games, smartphones, internet, tablets, etc. Trying natural supplements. Consult with your doctor first. You should speak with your doctor before trying any herbal supplements for ADHD, as even herbal and natural treatments can interfere with other medical conditions or prescription medications. If your doctor gives you the go-ahead, consider some of the following remedies. You should always consult with your pediatrician before giving any herbal remedies to children. Many are not safe for children's use, or should be used only under close supervision by your doctor. Drink herbal teas. There are several herbs that can help calm and relax you. Some have been proven effective at reducing feelings of stress and anxiety. When should you try this? Try natural remedies after consulting with your doctor. Even if you or your child exhibit symptoms of ADHD, you should get an official diagnosis from your doctor before attempting self-treatment. Effective ADHD treatment usually involves a combination of behavioral therapy and medication. Ideally, natural remedies should supplement this treatment instead of replacing it. Opt for lifestyle and diet changes over herbal remedies. While many herbal remedies and other natural supplements are safe for most adults, and for many adolescents, in some cases, the safest natural treatment course will rely on lifestyle changes and mild to moderate dietary improvements, since herbal supplements come with a greater risk of negative side effects or interactions.